Hey guys, this is Narayan Chintala from Sri Sathya Sai Medical College. Today I am here to explain you about respiratory acidosis. Coming to the introduction, respiratory acidosis is a condition that occurs when the lungs cannot remove enough of the carbon dioxide produced by the body. Excess CO2 causes pH of the blood and other body fluids to decrease, making them acidic. pH falling below 7.35 causes respiratory acidosis. The normal pH value ranges from 7.35 to 7.45. Respiratory acidosis is also called respiratory failure or ventilatory failure. Forms of respiratory acidosis: acute respiratory acidosis and chronic respiratory acidosis. Acute respiratory acidosis, it's a medical emergency. Left untreated, symptoms will get progressively worse, can be life-threatening. Chronic respiratory acidosis, it doesn't present symptoms as the body adapts to the increased activity. Common causes of respiratory acidosis. The lungs and the kidney are the major organs that regulate pH. Lungs remove acid by exhaling CO2. Respiratory acidosis is usually caused by lung disease or conditions that affect normal breathing or impairs its ability to remove CO2. Increased pH CO2 causes respiratory acidosis. There are few causes like asthma, COPD, including emphysema and pneumonia, acute pulmonary edema, scoliosis, and cardiac arrest. Coming to the prevalence and severity in Indian population, respiratory acidosis is found in 22 of 35 patients, that is 62.85%, with pre-dialysis serum pH and HCO3 are 7.32 plus or minus 0.083 and 20.37 plus or minus 4.94 millimole per liter respectively. Respiratory acidosis is significantly prevalent in patients on MHD in India. Coming to the biochemical basis, respiratory acidosis is an acid-base balance disturbance due to alveolar hypoventilation. Production of CO2 occurs rapidly and failure production promptly increases the partial pressure of the arterial carbon dioxide, that is PaCO2. Alveolar hypoventilation leads to increased PaCO2, that is hypercapnia. Hypercapnia and respiratory acidosis ensure the impairment in ventilation occurs and removal of CO2 by the respiratory acidosis. Signs and symptoms of respiratory acidosis. In acute respiratory acidosis, initially headache, anxiety, blurred vision, delirium, shortness of breath, and finally coma. And in chronic respiratory acidosis, it doesn't present any symptoms, but some signs are noticeable, are subtle and specific, which may be as follows, like memory loss, personality changes, and sleep disturbances. The diagnosis of respiratory acidosis: blood gas measurement measures oxygen and CO2 in blood. High level of CO2 can indicate acidosis. Electrolytes measures the level of sodium, potassium, and chlorine and bicarbonate, and reduced lung functions may say respiratory acidosis. Coming to the treatment, acute form treating acute respiratory acidosis means immediate addressing of the presented symptoms. Chronic form treating chronic respiratory will focus on improvement or management of airways function like antibiotics, diuretics, bronchodilators, corticosteroids, and mechanic ventilation. I conclude this by giving a take-home message. Way to lower the risk of respiratory acidosis is to avoid its causes. Choosing to live a smoke-free lifestyle is advisable. Smokers are at high risk of chronic respiratory acidosis. Maintaining a healthy normal weight can reduce risks. Thank you.